Welcome to the MD Edge Daily News for Thursday, August 30th. I'm your host, Nick Andrews.
And I'm MD Edge editor Mary Ellen Schneider. Today, risankizumab proves more effective in psoriasis than ustekinumab.
Also today, a cirrhosis study finds no link between screening and liver cancer mortality.
And later, eosinophils could be a marker for nonceliac gluten or wheat sensitivity.
But we begin today with a link between declining lung function and heart failure and stroke. Rapid declines in spirometric measures of lung function were associated with higher risks of cardiovascular disease, and rapid declines in forced expiratory volume in 1 second, or FEV1, were associated with increased incidence of heart failure, stroke, and death. This is according to a recent analysis of a large prospective cohort study published in the Journal of the American College of Cardiology. In the study, the researchers included a total of more than 10,000 participants, all of whom had undergone spirometry at the first and second study visits. The researchers report that rapid decline in FEV1 was associated with a higher risk of incident higher heart failure and was most prognostic in the first year of follow-up. They also report that rapid decline in forced vital capacity was likewise associated with a greater heart failure risk. Dr. Odelson Sylvester is a researcher in the Division of Cardiovascular Medicine at Brigham and Women's Hospital in Boston. Dr. Sylvester notes that the risk of incident heart failure among FEV1 rapid decliners was particularly high, with a 4-fold increase within 12 months. He says that this suggests that clinicians should carefully consider incipient heart failure in patients with rapid changes in FEV1.
Risankizumab showed better efficacy than ustekinumab in treating patients with moderate to severe plaque psoriasis, but with similar safety. This is according to the results of a pair of head-to-head trials published in The Lancet. Risankizumab is a monoclonal antibody that targets the P19 subunit of interleukin-23, while ustekinumab targets both interleukin-23 and interleukin-12. The two trials together randomized nearly 1,000 patients with moderate to severe plaque psoriasis to receive one of the two drugs or placebo. The co-primary endpoints were the proportion of patients who achieved a 90% reduction in psoriasis area and severity index, also known as PASI 90, as well as a static physician global assessment score of 0 to 1. In one of the trials, more than 75% of risankizumab patients achieved PASI 90, compared with about 5% of placebo patients and 42% of ustekinumab patients. Results were similar in the second trial. Dr. Abigail Klein and Dr. Stephen Feldman are researchers at Wake Forest University in North Carolina. They say that selectively blocking interleukin-23 with a P19 inhibitor appears to be one of the best ways to treat psoriasis. You can read their comments as well as more detailed data from the studies, including secondary endpoints, by clicking the link in the description.
Screening for hepatocellular carcinoma up to 4 years prior to diagnosis was not associated with lower mortality. This is according to results of a case control study of patients with cirrhosis published in Gastroenterology. Researchers included data from 238 patients from the Veterans Affairs healthcare system who had died of hepatocellular carcinoma between 2013 and 2015, and who had been diagnosed with cirrhosis at least 4 years prior. They compared these cases with an equal number of patients with cirrhosis who had been in VA care for a similar amount of time and had not died of hepatocellular carcinoma. The researchers report that there were no significant differences in the proportion of cases and controls who underwent screening ultrasonography, screening serum AFP, either test, or both tests within 4 years. Dr. Andrew Moon is a researcher at the University of North Carolina. Dr. Moon says that there was also no difference in the receipt of screening tests within 1, 2, or 3 years prior to the index date. He notes that these findings suggest that either the scoring tests or the currently available treatment of liver cancer, or perhaps both, are suboptimal and need to be improved.
And finally today, in the absence of endoscopic findings, the presence of duodenal and rectal eosinophils could be a marker of non-celiac gluten or wheat sensitivity. This is according to new research published in Clinical Gastroenterology and Hepatology. Researchers included data from 78 consecutive adult patients who attended 2 tertiary referral centers in Italy. A control group of 55 patients either had celiac disease or self-reported sensitivity, but with negative results from the wheat challenge. The researchers report that both duodenal and rectal biopsies were performed in both groups of patients after they had consumed a wheat-containing diet for at least 4 weeks. In patients with sensitivity, the mean eosinophil infiltration was more than 2.5-fold the upper normal limit in the rectum and nearly twice the upper normal limit in the duodenum. Eosinophil numbers in the duodenal mucosa were also higher in the sensitivity patients with dyspepsia than in the sensitivity patients without upper digestive tract symptoms. Eosinophil infiltration of the rectal mucosa could be a marker for sensitivity, but researchers suggest it cannot be considered a specific marker because eosinophils may indicate several conditions, including inflammatory bowel disease. And that concludes this edition of the MD Edge Daily News. You can find links to these stories in the podcast description. For MD Edge, I'm Mary Ellen Schneider.
And I'm Nick Andrews. The Daily News is now on Spotify, so you can listen to the top stories in clinical medicine in the same place you listen to your favorite tunes.